Hiya guys, look at how we get this ear canal from this to this lovely squeaky clean ear canal, that one there guys. So you can see in this one we've got this really dry layers in here. It's almost laminated. You've got these layers of skin, layer of wax, and it's all super duper dry. The reason it's this dry is because this particular patient is not producing as much oil as they normally should do on the outer portion of the ear canal, which means that the wax and skin tends to dry out on that canal wall. It doesn't flake away as it normally should. And you'll see that more prominently in the second ear canal for this particular patient. But this first layer, this was mostly skin. So we've just taken that away. Now underneath now we've got this harder wax layer. So we can see as we pull this little bit, there you go, you can see that harder chunk there right in the middle. The surface is a little bit softened because the patient's been using some olive oil just to try and soften this up for a couple of days before they come through. But a nice big old chunky piece of wax there. So by this point, patient's hearing much better. Yeah, we can see the eardrum, which means the sound can get down to the eardrum really effectively. But now we're just peeling off these drier layers on the bottom of the canal wall. There we go. Always got to be a little bit more cautious when you're down in these kind of right against the skin of the canal wall, just because it can be super duper sensitive down there. But eardrum looking lovely and healthy. Just a little straggly bit of dry skin arcing from that top section down the right hand side. So we're just going to get rid of that. There we go. And eardrum looking absolutely fab. Now when we take a look at this ear canal, we can see the orientation of the canal is a little bit different. So this one slopes upwards. And when we lift this first layer here, take a look at this now. As we lift, there we go. See all that dry skin peel. So this is going to be more of a peel of this dead dry skin first of all. I thought that was just going to be a little bit of wax, but when I started to lift, you could see that whole sort of front section of the canal there peeling away. And now we're going to have to get rid of this little bit of dry skin first. You can see I'm trying to kind of push it down out of the way, but it's just so loose. Every time we lift it up, it's just jumping back in front of the camera again. So we're just going to have to try and grab. What I'm trying to do is keep hold of that bit of skin, but also grab what's behind it, because it doesn't really want to budge. And what we have here is a very mushy type of wax. So the difference between the two is this particular ear canal was causing more problems for the patient. They were feeling more blocked up because the wax is going much deeper. It's against the eardrum on this side. So they used more oil on this side than they did the other, which is why you can see that sort of layer just all peeled up on the canal wall. But why the wax has got a bit mushier as well is because when you add a lot of drops, it just tends to absorb into the wax. It becomes really mushy, a little bit more difficult to remove when it's that kind of consistency. But you can see how deep this is here. It's right down against the eardrum. A little bit of dry skin there to the left-hand side, and this is peeling away in smaller chunks. The ideal scenario here would be to grab that section and draw the whole thing out, but I don't think that's going to happen. As you can see, it's all starting to crumble. Let's lift. Oh, I don't know. Might come. There you go. That's one section of it. Now, when that's resting against the eardrum, it's causing a lot more problems for the patient as far as their hearing is concerned. So imagine it's sandwiched between the canal wall and the eardrum here, and it's wedged in there. So it's going to really restrict that movement to the eardrum. Patient talking to me a little bit there, which is why the camera's sort of doing this a little bit. I don't mind patients talking to me, it's absolutely fine. Sometimes patients find it's, you know, they have questions about the procedure. They're asking me what's going on inside the ear canal. Sometimes it's more sort of keeping the patient settled. They like to have a bit of a conversation with you. They like to have a chat while you're doing it. Now, I have told the patient to just, this next bit's, you know, quite delicate to get to. It's a little bit more difficult. So what I've told the patient now is just try and be as quiet as you can. They're moving just a little bit, and I'm being really cautious. You can see I'm dropping back and taking another look at where we are. I just want to try and get this soft, squishy bit of wax from the top of the eardrum. There we go. Out that comes. And we're just going to tidy up this right-hand side now, just a little bit to take away here. There we go, some flaky bits. Let's get that bit as well. And that bit. There you go, it's all coming away really well. And this last little bit. You can see I'm just kind of gently, gingerly taking this away. It's only a tiny little bit. It's not going to cause any real kind of issues. But we can see the eardrum nice and clearly, and you can see the staining on the eardrum where that was actually stuck to the drum. So we've got 3/4 of an inch, just over 1.5 centimeters there, guys. This is a good one. See how we go from this. It's going to come up in a second. To this. we have one of my favorite type of removals to do. Now, I'm gutted because this wasn't my patient. I would have loved to have done this one. So this is actually a canal wall peel. So we start off this first ear canal. This is one of Taylor's, and Taylor, in fairness, does a fantastic job of clearing this one. This is absolutely fab. If you are missing the lovely Mr. Taylor Green, he will be back on your screen soon. We're doing another voiceover session soon, so fingers crossed he will be back. But this first ear canal here, you can see this really, really solid. I mean, that is absolutely rock solid piece of wax down there in that ear canal, but looking a lot better now. Taylor just doing a bit of tidy up. This really kind of loose material, this almost like liquid material you can see here on the outside portion of the ear canal, that is basically where that rock solid plug, when the oil goes in, it softens the outside of the plug. So the outside becomes super soft, but it doesn't penetrate very well into the plug. This is that peel we were talking about here. So what we can see here, the whole canal wall is covered in wax, going all the way over the eardrum as well. So this is going to be a lovely one. Now you tend to find this, from my experience, in one or two ways. Either patients used a really aggressive wax softener, but not for long enough. And what's happened is it softens and breaks down the wax, and then it turns into a very, very thin layer that sits all around the canal wall. Or sometimes if you get it post-infection or post irritation inside the ear canal, and the patient's been prescribed some atomized spray, you tend to find it does this to the canal as well. So he's got rid of the main bulk. Now, take a look beyond. Now we've got this super duper thin piece of basically skin and wax. Now what you've got to think of here, these look really satisfying to do. They are really, really difficult to do, because these types of, oh, look at that. Look at that peel, guys. This thick layer. I love it. So sorry, I was totally unprofessional, but I do really enjoy these types of removals. I lost my train of thought. I got so excited about the peel, I can't remember what I was saying. Oh yeah, it's super duper difficult to do. Only because when you're trying to lift this and trying to peel these off the canal, you are working right against the canal wall. And don't think, this is less than a millimeter thick, probably, this kind of material. So you are working really, really close without touching the canal wall. Super duper difficult to do. Now, what Taylor's doing here is peeling that bottom section. I know what he's looking for. He's hoping he's going to get a lovely big peel that's going to go all the way down the ear canal, and I would be hoping the same thing would happen. What's going in his favor so far is that what we can see, that sort of, that sheen, that sort of gray material you can see underneath, that's actually a layer of dead skin. So if you can keep that dead skin peel going, what he's going to end up with is peeling this all the way down the canal, which should be fab. I would love it to happen. You guys know you would love it to happen as well. But fingers crossed that is going to happen with us today. So let's give this a little bit more of a peel down. There we go. So he's gently working his way all the way around the outside edge. He's trying to keep this as one big piece. So what he's doing is peeling in from all the different sides. If you kept going from the bottom, you can only go so far. When you get so far, you hit the roof of the canal. So you can, well, not hit it, but you reach the roof of the canal. You can't lift any further. So now he's working around the outside edge. He needs to drop back. If he comes back a little bit, I know he spotted it. There you go. You can see it peeling down. There we go. There we go. So he can see that piece now to the right-hand side. He's just going to lift this off. Well, he's trying to. You can see he's being really, really cautious. There we go. That's the lift. Now what I would do next is I would come back, exactly what he's doing there, come back a little bit where you can see it's lifted from the next section, and peel the next section, and keep working your way around the top of that canal there. Hi to all the new subscribers. We've had loads of new subscribers recently, which is really lovely. Thank you so much for choosing to subscribe to the channel. I hope you're enjoying it so far. Normally, if this is the first couple of videos, normally there are two of us doing these voiceovers. So the gentleman that's actually doing this removal would normally be voicing this over, but he was ill, unfortunately, and we haven't got much time in clinic together this week. So hopefully we'll get together really soon. Look at that peeling away. Look at that coming down. Now at this point, I would probably introduce a little bit of olive oil just to help this peel along its way, because you can see it's kind of a little bit on the brittle side. He needs to detach this piece. You've got these two flaps peeling down either side, and there's one little bit that's still adhered to the canal wall in the middle. That's what he's working on now. There we go. Oh, can we pop a little bit of oil in, do you think? Should we do it? Is he going to put some oil in? Oh, I don't know. He's going for it. He's going for it. Yeah, there you go. There's the oil. I knew it would have to go in soon. So basically, oil just helps it to ease it along its way. Now, when you get to this point, especially when it's deeper and you're getting close to that eardrum peel, I'm really hoping there's an eardrum peel on here because I love an eardrum peel. When that goes over the top of the eardrum, the oil just helps to help it sort of loosen it. There we go. You can see it's really loosening, and then it works underneath. And that stops that flap from flicking back down to the canal wall and re-sticking. So are we going to go for, sorry guys, are we going to go for a peel? Are we going to get this in? Let's have a little look. Ooh, forceps, brave choice. You must be confident this is tough. Let's have a little look. Oh, you can see the top left. Look at that top left, that's going over the eardrum as well. It's lifting from the bottom now, going back over the drum. You can just see underneath the blue of the eardrum there. Oh, I think that was an eardrum peel as well. Oh, he didn't show us what came out. Taylor Green. Wow, that is a lovely peel. That was a good one. I enjoyed that one. So we're just going to get this little bit off the top here. Is this going to go? I'd probably go fine end now if you're struggling with the angle. Difficult forceps sometimes when you get these bits of drop down from the top just to get the angle you need. There we go, out that comes. My goodness, what a difference in an ear canal, oh guys. Look at that eardrum now, looking lovely and clear. So we have, just under 4 centimeters, 1.5 inches of wax and skin there as well. Well, guys, I hope you enjoyed that as much as I did voicing. That was a good one. I enjoyed that one. As always, guys, if you do enjoy it, then please like, heart, share, follow, and subscribe. If you thoroughly enjoy it, you can also consider becoming members of the channel. That way, then you get to see even more videos. As always, guys, take care of yourselves, take care of your ears, and take care of one another. And I shall see you for the next video. Bye, everybody.